It totally depends on your personal experience. So
Okay.
for me,
Okay.
I really miss AIIMS.
You wish to explore everything means you go and explore. Don't bother about that people. Okay?
It's not an easy job.
Okay, fine.
Don't think about PR or money. When you are a nurse, you'll see life is not easy. Your job is so stressful. You'll be having so much stress, no time for yourself.
Okay, Harshita, thank you for your wonderful and elaborate information regarding that New Zealand process. And can you share about your previous workplace and previous work culture in India? Because as you said, you worked almost in 3 years in India, right? If you don't mind, will you share about that?
Yeah, sure. So
Okay.
I was working in AIIMS Delhi as a nursing officer.
Okay.
The working culture was good. Everything was good. Even my co-workers was really nice.
Okay.
But still I was not satisfied. So I came to New Zealand. What else do you want me to say?
Okay, that's fine. I asked what kind of workstation like that, and what about the works, everything. The people are good. I think you are the first person saying about good things about Indian hospital after moving to abroad. You should-
It totally depends on your personal experience. So
Okay.
for me,
Okay.
I really miss AIIMS. It was my best 3 years.
Okay.
Recently I went back to India and the first place that I visited was AIIMS. I really missed my co-workers, that environment, everything, even the smell.
Okay.
Oh, I was working in gastro department, and you know how government hospitals are. Still, I miss that.
Okay.
And if somebody will ask me, "Do you want to go back?" That's the most question. That's the what should I say? If somebody will ask me, "Do you want to go back?"
Okay.
I would say no. I really miss that, but no, I will not go back.
Okay.
So even in New Zealand, I'm not happy, but still, I'm learning. In AIIMS, I was settled. That's the word everyone was saying.
Yeah.
That now have achieved everything. There's nothing left. You can just try to relax and enjoy your life. So I'm just 27, so I don't think so. It's the right age to get settled. So now I
Yeah.
must say, if you want to, if anyone will ask me, what's better, government job or going to abroad? Again, it's my personal opinion. I don't want to hurt anyone's sentiments.
Okay.
AIIMS is really, really good. You will get a good salary, respect, everything, but there's no opportunity to grow. You will be doing the same thing that you have done when you started there and even after 10 years. Okay. Especially for general category. They are like AIIMS Delhi. I'm talking about AIIMS Delhi, not the other AIIMS. You'll be doing the same thing. You'll be working as a nursing officer, bedside. There will be nothing new. You will be doing the same thing. And if you are happy doing that, then it's all right. Otherwise, better to find something else.
Okay. I understood.
So,
Yeah. You can continue.
yeah. But other than that, yeah, AIIMS was good. I really miss this place.
Okay.
And talking about the working culture,
Yeah.
Again, it depends on your personal experience, but for me, it was really nice. My co-workers were like family. I spend most of my day in AIIMS, not at my home. Even if I'm off, I'll go with my co-workers. So in New Zealand, you can't expect like this. They really mind their own space. I don't want to work bedside. I don't want to do bedside nursing for whole life. So I moved from AIIMS now.
Okay.
I have to move on.
I totally
So
don't
now
worry.
in New Zealand, I am studying. Yeah.
Yeah, yes, you can continue.
Okay. So in New Zealand, I'm working in aged care just to pay my rent. After that, I'll move somewhere else. I will find something else. In New Zealand, you have much options. You can work anywhere. If you want to work as a nurse practitioner, as a nurse prescriber, you want to work independently, you have so many options. If you want to do clinicals, non-clinical, so many options are there. And as compared to India, you get paid more.
Okay.
And still in India, nobody respects nurses. You
Okay.
have to demand. Nobody says. Still, they are saying Sister G, Sister G. So I didn't spend my 4 years, so somebody can call me Sister G.
Okay. Among this all you said, I totally understand your concern and emotions about one point. What that means, people are still scolding you why you left the AIMS and went to New Zealand, right? Okay. For that, I wish to say something. Please don't bother about the other people's because priority matters. That's our wish, and our each and every person have a different point of view and different point of expectation and lifestyle and culture. Don't please bother about the other people. As you are now working in New Zealand, that's good. That's even better than working in India. India, it's good better that as you wish to work in abroad like New Zealand countries, that your personal choice and personal opinion, personal wish also. That's then why do bother about that people's? Okay, just feel stay happy and stay healthy. And as you said, you wish to explore everything means you go and explore. Don't bother about that people. Okay.
All right, I'm trying.
Okay, fine. Even for the first time when I'm hearing that, I used to thought about that only. Why she took this like that? Why she done like that only? After sometimes I realized that's a her point of view, her wish. That's good, fine, fine, better. Okay, fine. May I know what is the difference between, as you observe, Indian sector and New Zealand sector as a staff nurse. Okay, this is different and this is crazy. Like that, you may observe anything.
Yeah.
Okay.
So in India, we are still using paper chart,
Yeah.
paper charting. Here, everything is electronic. You have to be perfect. Whatever you're documenting, it's a legal document. You need to be sure that whatever you're writing, whatever you're mentioning, it's correct, it's accurate. If something goes wrong, they'll be after you. You will lose your license.
Okay.
I learned it the hard way, trust me. So you have to be sure, you have to be alert 24/7. You can't mess with your license. And even for tiny, small, little things, they'll be after you. So I come from government background. There, it won't matter that much, but here, little things matters. So you have to be sure, you have to be accurate, you have to trust your judgment. You can't go wrong.
Okay.
So that's the main thing that I learned. And what else? In New Zealand, especially if you got so much experience, like I have seen people 10 years experience, 12 years experience, but they are not good with the computer thingy. They don't know how to document, they don't know how to save something, like they're not good with electronic, how do you say? Like the technology they are using here, how to document, how to save. Like if you're working in GP practice, they are using a system medtech. In HK, they have their own system. In DHB, they have their own. So you have to learn that, and you have to be fast. So you have to be What's the word? I don't
Okay.
know.
You have to be proactive.
Technically smart, I might
Yeah.
say.
Proactive or
You should
multi-talented.
be, yeah, yeah, and don't feel shy to ask something.
Okay.
Ask. If you don't know, ask. No one will going to judge you. If even if they are judging you, they don't know you, so it's better to ask.
Yeah.
Because if you do a mistake, nobody is going to listen to you. That you can't make any excuse. You have to be sure that you are the RN there. You have some responsibility. So yeah,
Yeah.
that's why they're paying you so much.
Okay, that's good. That is, thank you for sharing your that different work cultures in New Zealand and India. Okay, if you're Indian nurse or Indian nursing student who wish to
Yeah.
come to New Zealand, what is the first advice to give?
No one cares if you're working in AIIMS or you were charge nurse there or you had so many experience. Nothing matters. When you come to New Zealand, you are treated as a freshly graduate nurse here because you are new to the system. They are not judging your clinical experience. They are just because you are new to the environment, to the culture.
Yes.
So just be open-minded and ask questions and don't feel shy or nervous. At the end, we all are nurses. We are here to help each other.
Okay, that's good.
And if you're new to nursing, like if you are a student, first year student, or who is just thinking about nursing, it's not an easy task. And you have to do it by your heart. No book can teach you how to care for a patient who's dying.
I understand.
So
I understood what you are saying.
yeah,
It's all about our personal feeling and personal. We have to learn and everything. We have that's time only we can survive in the
can't
field
be
of
my book.
nursing, right?
Yeah, so it's not an easy job.
Okay, fine.
Don't think about PR or money. When you are a nurse, you'll see life is not easy. Your job is so stressful. You'll be having so much stress, no time for yourself. But at the end, I think when you see the smile on the patient's face, it's worth it.
Okay, that's good.
So yeah,
One more questions regarding New Zealand. If you are working in the New Zealand, is there any possibilities of moving to Australia? Whether is there any procedure or it's little bit easy or difficult?
through TTMR pathway, you can transfer your New Zealand nursing registration to Australian nursing registration. You don't need to give any exam, no English requirement, nothing. You just need to apply online, and within a week, you will get your registration for Australia. And then you can work as a nurse in Australia. It's
Okay.
easy.
Okay, that's fine. What about the PR and all, like personal resident? Like, if you are staying
For New Zealand, yeah,
PR.
nurses are in green list.
If I wish to
For
get
New
PR means what I have to do? What are the basic requirements? If you know means you can share. Otherwise, we can skip this question.
for PR,
Yeah, PR.
nurses are in green list. If you got a job offer,
Okay.
then you can directly apply for PR.
Okay.
Don't need to apply for work visa or anything else. You can just directly apply for PR.
Okay.
That's what I did.
Okay. Is there any minimal year we have to stay in New Zealand? After that, only we can get that PR.
No, but that's the general rule for everyone. One will get a residence visa first, straight to residence visa. Then after 2 years, you can apply for permanent residency. There's not much difference. Just some travel restrictions are there. Otherwise, everything else is same. So I got the residence visa when I got my first job,
Okay.
and within a month I got my residence visa. After that, now in 2026 I can apply for permanent residency.
Okay. Do you know what are the cost for the process like that? Is that free of cost or need some much of amount?
Uh, Recently, I think they increased their fees, so it's going to be costly.
Okay, that's fine. You almost had
I'm not sure
everything.
about. the cost.
Okay, okay. At last, we can conclude. If you are a student, if you are wish to choose nursing, means nursing is a good field for earning money and to serve people. If you are wish to work in India, means that you can get a high paid jobs in Jitmur hospitals and AIM hospitals and some other private sectors. Move to the countries like as the sisters working in New Zealand and Australia and Europe countries and even Canada, lot of countries is there to work and getting a get a payment when compared to our nation. That's fine, but in my point of view, nursing is good only. Anyone can choose, but little bit while studying and while getting experience in India, that time maybe it may be a little bit hard. You should stay
Yeah.
consistent and keep on updating your knowledge, and we should learn daily at least any topic about the medicine or any uh, disease condition like that. It will be helpful for your knowledge and career growth, and communication is one of the best tool for the nursing. And at last, thank you Ashita for your wonderful time. Almost you spent 1 hour with our podcast, and thank you so much for your wonderful time. And you almost covered everything about that New Zealand work life culture and process and your personal work experience, everything you covered. Thank you so much for your wonderful time. As the viewer, you are watching, for you, thank you so much. If you are watching this video for the first time, please subscribe to our channel. And I am just collaborating her to Instagram, like reels. I will collaborate. If you are wish to ask any doubts, or you can follow her. She also putting a lot of reels regarding the nursing atrocities. Thank you so much, Harshita, for your wonderful time. Thank you so much.
Thank you for having me.
Okay.